Now today, March 24th, is World Tuberculosis Day, a day to raise awareness that this condition continues to touch so many lives. Korea is not immune to this awful disease, with nearly 35,000 new TB cases reported each year. On top of this, Korea also has one of the highest tuberculosis mortality rates in the OECD. In response, the Health Ministry is stepping up efforts to hopefully systematically eradicate the disease. Yeon reports.
This patient, identified only by her surname Jung, recently found out that she has tuberculosis. She says she's been coughing constantly since last fall and often experiences shortness of breath.
I've been stressed recently due to problems at home. I couldn't eat very well.
Jung is one of the 35,000 patients who were recently diagnosed with tuberculosis in Korea. The country sees nearly 8 times the number of TB cases compared to the OECD average. Korea has one of the highest fatality rates from the disease among member countries. More than 2,200 patients died in 2013 alone. Doctors say it's important to wash your hands thoroughly and detect tuberculosis in its early stages. They advise getting a medical checkup if coughing lasts for more than 2 weeks.
Patients delaying treatment are highly likely to suffer from hemoptysis or coughing up blood. Tuberculosis patients that enter the intensive care unit from cases like these, the mortality rate is close to 100%.
In response, the Ministry of Health and Welfare is increasing efforts to eradicate the disease. It's dispatching around 400 medical personnel to community medical centers across the country so that each tuberculosis patient can get more intensive attention. The ministry is also cutting the cost of treatment. Starting in 2016, tuberculosis patients won't have to pay a cent for medical help for the disease. Overall, the ministry expects to reduce the number of TB patients by half by 2020. Kim Jung, Arirang News.